So good morning, everybody. Today we can learn about admission, transfer and discharge procedures. It's a topic from Nursing Foundation. Admission means admission to hospital. So when we are getting admitted to hospital, what are the procedures regarding this transfer and discharge and admission? That's what we are going to learn in this chapter. Okay, first one is hospital admission. Admission is allowing a patient to stay in a hospital for observation, investigation, treatment, and care. Can you see the slides? So what is admission? Admission means entering into a hospital or getting admission in a hospital. It is allowing a patient to stay in a hospital for observation, investigation, treatment, and care. It is the entry of a person into a hospital or ward for the therapeutic or diagnostic purpose. So admission means entry of a person into a hospital. So what are the purposes of hospital admission? Main purposes are to receive the patient, to provide comfort and safety, to provide immediate care and maintain privacy, to obtain needed data. So what are the general purposes of hospital admission? To receive the patient, that is, when a patient is admitted to a hospital, when a patient comes to a hospital, the staff, the hospital staff or the healthcare staff will receive the patient and help him to adjust to the hospital environment and to provide comfort and safety. By giving instructions and needed care, hospital staff will provide comfort and safety to the patient. To provide immediate care and maintain privacy. There are some situations which need urgent care or immediate care. So in hospital admission, the patient will get immediate care and along with maintaining the privacy. Privacy has to be maintained. To obtain needed data, we are admitting a patient in order to get needed data or health related information from the patient or relative. During admission, we will collect some data which are helpful for the diagnosis and treatment. To observe and report signs and symptoms. Next purpose is to observe and report signs and symptoms. There may be some signs and symptoms particular to specific diseases. So hospital admission help us to observe these symptoms and also to report these symptoms and signs and symptoms. To maintain proper health records and reports. Admission help us to maintain proper health records and reports. Next purpose is to respect for the person and a person's property. While the patient is getting admitted to the hospital, we will hand over their valuables, so jewelry and all other valuable things to the client or to the family. So, when a patient getting admitted to the hospital, we will hand over all the valuable things and jewelries to the relative or the patient. So these are the main purposes of hospital admission. First one was to receive the patient, to provide comfort and safety, to provide immediate care and to maintain privacy, to obtain needed data, to observe and report signs and symptoms, to maintain proper health records and reports, to respect for the person and person's property. Next, we can see about the types of hospital admission. So what are the main types of hospital admission? Generally, there are three types like emergency admission, elective admission, and a routine admission. So first one is emergency admission. What is emergency admission? The admission done in case of emergency situation, that is acute conditions requiring immediate medical treatment. Here we will get life-saving care. For example, patient with accidents, burns, poisoning, heart attack, etc. So emergency admission means patient is getting admitted to the hospital in an emergency basis. Like if the patient is on accident, if a patient, please switch off your camera. All of you, please switch off the camera. And okay, the emergency admission means admission in case of emergency situations like accidents, burns, or in some patients with a heart attack also getting admitted to the hospital in an emergency basis. Please mute your mic. Emergency admission, we will get a life-saving care. Patient is getting admitted to the hospital. He will be coming through the emergency department or the casualty in case of emergency admission. So in casualty or the emergency department, he will get the life-saving treatment. Next one is elective admission. Client may perform various investigation tests before admission date. This is a direct admission. Elective admission means it is a planned admission. Before the date of admission, the doctor will prescribe for some investigations. So these are the blood tests or these some radiological investigation to be done before the date of admission, and the patient will admitted to the hospital with those reports. So this is a direct admission. No need to enter through the casualty. The patient can come directly to the department for admission. Next one is routine admission. Here the patient admitted for specific investigation or treatment on a routine basis. This is like a for patient for monthly checkup or a dialysis treatment, like that. The patient will get admitted to the hospital on a routine basis. Example, admission for monthly blood checkup for a cardiac patient. So these are the main three types of admission in a hospital. First one was emergency admission. Second one is elective admission. Third one is routine admission. Is it clear for you? Is it clear for you? So we learned about three types of admission. And next we can see the admission process. What are the admission process? Usually admission process starts in the admitting office and the ER. ER means emergency department. Okay, admission process generally start from the admission office or the emergency department. That is the casualty. The basic identifying data and health history are collected. So after the emergency treatments, the clients will be directed towards the ward or concerned department. So in an emergency department or casualty, the patient will come and there we will collect some data, some information regarding the health and the disease and the family history, like history we will collect. And after the emergency treatment, we will give emergency treatment. In case of accident patient, we will give emergency treatment like poisoning patient, cardiac patients. All the needed emergency treatment will be given the casualty, and after that they will be directed towards the concerned department. Sometimes the patient will admitted to the ward, or sometimes the patient will get admitted to the ICU depending on the health condition. Then there are some special considerations to be followed before the patient arrived in the unit. So now the patient came at a casualty, and there he got some treatments and emergency medications and all. And after that, he is directed towards the ward or ICU. So what are the procedures? What are the requirements before the patient came into the ward? Unit means ward or ICU. Okay, so in a unit, the bed should be kept ready. Before the patient comes, we have to keep the bed ready and position the bed. Positioning the bed according to the patient need. That is, if the patient is a respiratory patient, or patient have breathing difficulty, or patient is a cardiac patient, we have to position the bed in a cardiac position. Okay, according to the patient condition, we have to adjust the position of the bed. Assemble necessary articles and special medical equipments. Before the patient comes to the ward, we have to arrange some articles like blood pressure checking apparatus or manometer and other medications. If the patient need oxygen, we have to arrange for the oxygen mask and all. Like that, we have to assemble whatever the equipments are necessary for that patient before admission. Check client's identification and a physician order for admission on arrival to ward. And we kept the ward ready for admission, and we made all the bed making and all. And after that, the patient comes, and we have to check the patient identification first. That is, by checking the name and the hospital number, we have to ensure that this is the patient supposed to come here only. Okay, so we have to check the client's identification and a physician order for admission. No patient should be admitted without physician order. So we have to check the patient identification, then we have to check for the physician order for the admission in the particular department. Then what we will do? Once the patient get admitted to the hospital, and what we will do? We have to greet the client and relatives and introduce yourself. That means once the patient come to the ward or the concerned department, as a nurses, we can introduce ourselves, that I'm a nurse and my name is this one, and I will take care of you, like that. We can introduce ourselves to the client and relatives. If the client is conscious, we can introduce ourselves to the client. Then we can check vital signs and obtain history. Vital signs means blood pressure, temperature, pulse, respiration. These are the cardinal signs. So we have to check the vital signs and obtain history from our part also. That is, we have to ask the health history of the patient, and we have to record it in the patient record. So these are some basic procedures when a patient comes to the hospital and the department. And after stabilizing the patient, we can collect specimen as per order. So the doctors will prescribe for some blood test, urine test, like that. So we have to collect the specimen. Specimen means that the sample. If a blood test is supposed to do, we have to collect the blood sample, that is a specimen as per order. Change to hospital dress, provide privacy. And once the patient getting to the hospital, we can provide hospital dress. Some hospital have a particular dress for the patient. Some hospital doesn't have that practice. So if your hospital have the practice of hospital dress giving to the patient, you can give hospital dress to the patient, and we have to maintain the privacy also. Then we can orient to the room, equipments and other facilities. That is, when the patient come to the ward, we can give orientation regarding the room and equipments. And this is the bathroom, this is the washing area, this is the dining area, like that. We can instruct the client and we can give orientation to the hospital facilities. Explain about meal time, visiting time, calling bell, etc. The patient may be new to the hospital, so we have to explain about what is a meal time, what is the lunch time, what is the dinner time, like that, and the visiting time. In every hospital have a particular visiting time, so we have to explain the visiting time to the patient and the relatives. And calling bell. Most of the hospital have the facility of calling bell near the patient side. So if there is a calling bell, we have to explain regarding the calling bell to the patient. Then only they can use it. And last one is recording. That is, when the once the patient come to your department and you introduce yourself, you get needed information and you check the vital signs and you done all the specimen collections and you give necessary orientation and all information. And after that, you have to record it in the patient record. So these are all about the admission, hospital admission. Is it clear for you? If you have any doubts, please tell me. Next, we can say about the transfer procedure. What is transfer? What do you mean by transfer?
One place to one place, something transfer means.
Please say aloud. I can't hear. What do you mean by
To
transfer?
another,
Navita, please say aloud.
Ma'am, to
I can't hear. Navita, please say aloud.
place to another place, ma'am.
Which one?
Transfer means carrying one place to another place, ma'am.
Yes, very good. So transfer means changing from one place to another place. Okay, that is transfer. In case of hospital, we will transfer a patient or we will change the department or we will transfer a patient from one department to another. Like if the patient was in ward for 2 to 3 days and if the patient getting worsen in his disease, we will change department to ICU. Like that, we will transfer the patient from one department to another. So patient transfer is moving the patient within the hospital departments or to another healthcare setting. Depending on the patient condition, he may be shifted to ward from ICU or means operation theater or to another hospital for specialized care. So in case of hospital transfer, we will move the patient according to the patient condition and according to the necessity of the treatment. We will move patient within the hospital, that is from one department, from ward to ICU or ICU to ward. If the patient was in ICU and he get cured and he recovered, we will change the department from ICU to ward, like that. This is a within the hospital we will shift the patient. That is one type of transfer. And sometimes we have to shift the patient from one hospital to another hospital. So if the patient is admitted to the general hospital and the patient is in need of specialized care like cardiac care or like that, we will transfer the patient from general hospital to multi-specialty hospitals. That's what we meant by hospital for to another hospital. So transfer can be from within the hospital or out from hospital, one hospital to another, or from healthcare setting like a primary healthcare center to another healthcare center, or primary healthcare center to larger hospital, etc. So there are some specific steps for patient transfer. What may be the steps for patient transfer? If we are plan to transfer a patient from one department to another, what we have to do in first?
We need to follow the some steps, ma'am.
We have to follow the doctor's instructions regarding transfer. Yes, then. So we can see obtain transfer order from concerned physician and inform the client and relatives about the reason for transfer. The main step is to obtain a transfer order. This is very important. It means we have to get a transfer order that from the concerned physician or the admitting physician. There may be different physicians in a hospital, and the particular patient belongs to particular department or particular physician. So from the admitting physician or the concerned physician, we have to get a transfer order. The physician or the doctor is the person who decide for this transfer of the patient. So we had to get transfer order from the physician, and we have to inform the client or inform the patient that you have to be transferred to another departments, or to the relatives also we can tell that these are the problems regarding you, and these are some facilities you will get in the another department, and this is the reason for your transfer, like that. So first thing is to obtain a transfer order. Then we will inform the client and relatives about the reason for transfer. And next step is to inform the new department in charge or new hospital about the transfer order to make necessary arrangements as per hospital policy. So once we get the transfer order and once the patient is ready for transfer, we have to inform the new department. That is, if you're working in a medical ward, and if the patient is getting transferred into surgical ward. So before transferring the patient, we have to inform the surgical department or the particular department that this is our patient, and such a patient is going to your department, so please make necessary arrangements, like that. Then only they can make bed making, they can do necessary arrangements for receiving that patient. So first thing is to obtain a transfer order. Then we have to inform the client and relatives and inform the new department in charge, or the new, we are transferring the patient from one hospital to another hospital. Like if a patient is admitted in a normal general hospital and the patient is in need for gynecology care, so we will transfer the patient to such a hospital like a gynecology specialist, maternity hospital, like that. So we have to inform the particular department or the hospital for patient transfer. Complete the patient chart, reports, and make medications and the articles. So we have to complete the patient chart. Every hospital, every patient has particular chart. I think you have seen that. Have you seen that particular chart or the patient records? There are some papers, some records. It will be filled with the patient information. Okay. So these are the patient chart. We have to complete the, and we have to check for the medications and the articles, the things, patient things. Medications, we have to give the medication on time. So before transferring the patient, we have to complete the patient chart, reports, and we have to check the medications and the articles. Then arrange for transportation. That means sometimes we will transfer the patient in wheelchair, or sometimes in stretcher, or sometimes the patient will go by walk. Or if we are going to transfer to another hospital, there should be some particular vehicle for transportation. So we have to arrange transportation. Then document the procedure. Documentation, record. That is, we have to record each and everything. If it is computer, it's okay. We have to record the computer, document it. Or if we are in writing, We have to write concerned information before transfer. After patient room, that means if the patient once the transfer is over, the patient have to the patient room have to be cleaned. It is meant by after care of the patient room. So what were the patient transfer procedures? First, we have to get transfer order from the physician, and we have to inform the client and relatives regarding the reason for transfer. And we have to inform the particular department regarding the patient to your department or your hospital, like that. And before transferring, we have chart reports and medications to be checked, and all the articles. If we are keeping articles in the hospital custody, we have to give it back to the patient, and we have to arrange quotation and document the procedure. Documentation is very important. We have to document all the procedures and after care of the patient room. That we have to clean the patient room according to the hospital policy once the patient gets transferred. Is it clear?
Yes, ma'am.
Okay. Now we can
Ma'am,
learn.
ma'am.
Yes. So can I move to the other topic, discharge?
Yes, ma'am.
The next one is discharge. So we learned about admission, and the third part is discharge. What is discharge? Discharge is the official departure of a person from a healthcare setting. That is, if the patient is admitted to the hospital after getting the necessary treatments, and once the patient gets cured, the doctor will order for discharge, that the patient can go home. Like that. That is the word meaning discharge. This is the official departure of a person from a healthcare setting. Discharge plan should be done at the time of admission itself. It means once a patient is getting admitted to the hospital, at that time onwards, we have to plan for discharge. That is, doctors will decide how long it will take the treatment. Like if it is a simple fever, that the doctor will say it will take 3 or 3 years. More care, say that your treatment for long, 14 days or 15 days, like that. So this is the discharge plan. We have to arrange the we have to make a discharge plan at the time of admission. So many types of discharges. First one is planned discharge, then LAMA, then abscons, first transfer process, and the referrals. Discharge means once the patient once the treatment is over and the patient get cured, all the treatments are complete, physician will order for patient discharge. That is a normal cases, as you know. Once the patient is admitted to the hospital and he got all the treatment and all the medication and all, and he got cured, so the doctor will say today or tomorrow you can go for discharge, like that. That is a planned discharge. Next one is LAMA. LAMA means leaving against medical advice. So there are some situations if you want to, the patient want to go for discharge in the hospital. Even if the client is not fit for discharge, the patient want to go for discharge. Like in case of some students, if they are admitted to the hospital and they have university exam, they will tell the doctor that, sir, I have some examination, so I want to go for discharge. But the treatment is, so this type of discharge means leaving against medical advice. Some patients will plan for some travel and they have taken the flight ticket and all, and in between them, and so, in patient also the patient will ask for discharge. And if the patient is not satisfied with the treatment, if the patient is not happy with the hospital atmosphere, then also some patients will ask for LAMA or leave against a medical advice. Next one is abscons. In case of LAMA, there are some consent. It is very important to take LAMA consent because it acts as a legal document. If in future if there is any problem rising that the treatment is not complete and the doctor is discharging the patient, there should not be any problem like that. So lama patient, we have to get consent. That is, I am going against a medical advice, like that. There is a consent. Next one is absconds. Abscond means client will leave the hospital without any prior information. Like they will go by their own their cell phone, their own vision. Okay. In Lama, they will ask for permission, but in abscond, they will not ask for permission. This is mostly occur in case of financial problems. If the patient cannot handle that the financial um, or the bill, hospital bill, will go without information. It is meant by absconds. Then discharge on request. Some patient will ask for discharge, request for discharge. Like if the patient is not happy to continue the treatment, and if the patient want to go for other hospital, like that, the patient will ask for discharge. Next one is transfer process. Some patients are getting discharged because of the transfer reason. So if the patient like the transfer process, patient from the getting transferred to another department, another ICU, that process also comes under discharge. Discharge for transfer process. For example, if if a patient is admitted in a general ward and he's in the ward, he is diagnosed that he is having cancer. So we will shift the patient or transfer the patient from the oncology special wards or cancer specialized wards. That is also comes under discharge. Then referrals. Referrals means we are referring one patient to higher level of for the hospital with the high facilities, like from nursing homes or a primary health center. Patients will get referred specialized hospital in the nearby area or to the other hospital as on their wish. So these all comes under. First one is planned discharge, that is a normal discharge. Then LAMA, leave against medical advice. Then absconds, going by their own without information. Discharge on request. Some people will ask for request for discharge and will go for discharge. Transfer process. And last one is referrals. Is it clear? Is it clear? Now we can care of unit after discharge. So once the patient leaves the unit, all articles in the room should be and disinfected accordingly. So after maybe by patient got discharged or patient got transferred, like that, once the patient leaves the unit, we have to arrange all the articles. We have to clean all the articles according to the hospital. There will be some policy for disinfection and cross infection are also. We have to clean the room according to the hospital policy and kept ready the room for another patient.